Hi Krupa, how are you?
Hi, I'm good. How are you doing?
I'm good, thanks. So tell us something about you. What do you do? Who you are?
Okay, so my name is Krupa. I'm a general dentist. I practice here in Nairobi, and over the past couple of years, I've been trying to broaden my focus, I guess, into functional medicine and just overall function, whether it's pertaining the head and neck or the rest of the body. So for now, my main focuses are dentistry and functional medicine.
Okay. Now, wow. Okay. So you did dentistry after school at university.
Yeah.
Okay. Where did you go?
So I studied at the University of Nairobi. I did my bachelor's there. I haven't yet gone to doing a master's. I'm not sure that I'm going to, but for now, I'm just practicing as a general dentist.
Okay.
And then hopefully I can broaden my scope of practice once I've sort of established more of what I am currently doing.
Okay. So
Yeah.
obviously, my next question is, how did you get into functional medicine?
Oh, okay. So that's been a bit of a journey.
Yeah.
I've had a few of my own health concerns. Nothing dramatic enough that is terminal or fatal. Just from the day to day, that was sort of affecting my function on a day-to-day basis.
So like, okay, what kind of things are we talking about?
So it started off first as like a pain in my hands and my legs. Well, one leg rather. This was while I was still in dental school, in my final year of school. And then my symptoms would sort of switch on and off or just progress, or something new would show up. And this is like over a couple of years. And then more or less, those are the kind of symptoms that I was sitting with. So I developed some nerve compression in my leg, in my spine.
Okay.
Which is why I had the leg pain.
Mm-hmm.
And similar thing happening with my neck as well, which was affecting my hand.
Stiffness or
nerve compression.
Okay.
So basically what was happening was because of the nerve compressions, I was having challenges with my fingers. They would hurt quite often. And over time, I guess because I'm trying to compensate, I'm not sure exactly what happened. My wrist started acting up. So I started developing tendinitis and then carpal tunnel syndrome. So it was that. So basically that's kind of like the progression.
So when you had all these symptoms, obviously, like, did you tell anyone? Did you see any doctors?
I did.
Okay.
So initially, because there was a lot going on just overall, because of dental school, that I didn't focus on the pain until it started affecting my ability to do things. Like my fingers would go into spasm and I'd drop a phone or I'd drop what's in my hand. Now that's when I was like, okay, this is I'm not going to be able to work like this.
Yes.
So that's actually why I was like, I need help. So I did see a physiotherapist at that time. I didn't go to see an osteo. Yeah, I didn't go to see an osteo yet.
Okay.
And we did do a couple of physio sessions, and it was helping me get by.
Okay.
But it wasn't. We hadn't yet identified exactly what was happening. And then also the assumption was, oh, you have a family history of rheumatoid arthritis in your family. So, maybe like these are symptoms associated with that. So we did a little bit of testing.
So but you're so young. So like even for someone to say like you've got an onset of arthritis from that age, it's a bit scary.
Yeah. So at that time, I don't think I panicked.
Okay.
Again, I feel like it was just, when you're like focused only on one thing. And for me, it was, I need to just finish dental school. I I'd have done anything to make sure that happened.
Okay.
So I would just sort of brush things off until I couldn't. And this was now right before my exams. So yes, I'm sure there's a component of the stress, but there was more than that, which at the time, none of us were thinking of. We were just like, oh, but maybe your vitamin D3 levels are low, and it's the stress and it's the anxiety. So it was just brushed off until a point where sitting now was painful. I couldn't sit for more than 5 minutes. My fingers were spasming, so I couldn't hold my pens or instruments for too long. So I'd have to like keep putting them down, taking breaks.
But your work is with
so that's when I started panicking. I did get through dental school with a lot of help and honesty, understanding from like my examiners. You know, I still obviously completed my exams and I passed. There wasn't like any shortcuts there, but they did really give me a lot of consideration, which I'm grateful for. Now, after then is when now things started getting a lot more painful because I couldn't sleep, because every time I need to turn, I have to get up, and my leg would just keep hurting. I had already started developing migraines then.
Oh my God.
So I was just on a lot of painkillers. So I would get through with a lot of painkillers. Now, I don't know if it was because of a lot of those painkillers, but then now is when like I started getting like reflux.
Okay.
Yeah. Digestive issues.
Oh my God.
My TMJ would get locked. So like it was like a slow progression of other symptoms coming in.
So nothing is stopping at this point. In fact, you're adding to the list of your symptoms.
Yeah. So there was just more and more happening.
And you don't know what actually is wrong with you by now.
At this point, it was just, I did now, obviously by then I'd seen a few doctors. And because we couldn't put a diagnosis to it, well, for my back, we did. I had an annular tear.
Okay.
So like a slip disc that was causing the nerve compression.
At least you have one answer.
And then there was a few other like disc bulges and things like that. That's why I had the nerve compression. So physio would help get by.
Okay.
But then I was still doing the same things that were causing the insult. So it would be going to work and then going to physio. So just so that like, the next day you're good to work. So I would go for physio like at least 3 times a week. Well, 3 times a week. So it was just helping me get by. We weren't actually getting to a point where I was doing things differently, well, considerably differently, that I'd feel better. Now, while all of this was happening, the migraines just kept escalating. It initially started off as maybe 3 or 4 days, then 5, then 6, and then it got to a point where I would have a migraine 13 to 14 days of the month.
And how long would these last?
13 to 14 days of the month.
No, but like full day. Like how many hours?
I'm just in pain. I was just
constant.
in pain. If I'm not on painkillers, I was in pain.
Wow.
So I was not sleeping. So my mental health took a deep dive. I wasn't doing very well then. Again, I was seeing some of my doctors, and because we couldn't find like a clear reason for all of these things happening, just that there was some form of inflammation in my body, because my inflammatory markers were always high. But we couldn't find why. We did do a lot of ruling out, a lot of testing. So it would always be, oh, nothing's wrong with you. Let's see you in a month. And then I get a new prescription for painkillers for different pains that were ongoing. And it started getting to me because, one, I felt like, am I a little crazy? 2, was also, I think, just hearing that constant, nothing's wrong. So it made me start doubting myself, like, is this happening in my head, or is this something that I'm actually experiencing?
Oh my God.
And I did find like my regular doctors that I would go to for acute episodes of anything. They were really supportive, really helpful. So I guess that helped me maintain some form of sanity. But there was a lot of nothing's wrong, and like, let's see you in a month. And I don't think there was like any ill intent there, or like they're actually trying to gaslight somebody. It's just that your lab's looking fine.
Exactly, and that's what they go by.
Yeah, so if you're looking at labs and they look good, then technically you're good, you know.
So then, like, and then at what point did you start, you know, taking matters into your own hands and doing this research? And
so I did. Well, actually, it was one of my doctors that sort of got me onto that path. And it was getting me onto something called CoQ10. It's an enzyme to help, just to see if it would help with the migraines. And at this point, we'd tried a lot of preventive medication. And even if some worked and we reduced the episodes, some didn't quite work. So there's a lot of trial and error, and I do understand, like, sometimes that's just the way. So we started stopping all the preventive care, and then I did more research on CoQ10, and I started taking CoQ10, and I was like, some difference in my migraines. And then from there, I was like doing more and more research, more and more reading, to understand what are the other reasons for migraines. If it's not a neurological cause, what else could it be? And it led me down a few different paths, and I just started trying to map out patterns. So at this point, I didn't quite realize that I was already like going down that functional medicine path. It was just all of this, just doing it on my own. But then one thing led to another, and that's when I came across these functional medicine articles and programs. So I started adopting a few more changes. So I was like my own guinea pig.
Yeah.
I started implementing a few changes.
So changes with your lifestyle or food, or
with
what?
With my food.
Okay.
A lot with my food, because I think my meals have been like erratic. I hadn't eaten well in a very long time. So even if my meals at home would be healthy, I didn't spend most of my time at home. You know, whether it was work or school before then. It was like, I mean, that's how it is for most of us, right?
So you like eating on the go?
On the go. So it wasn't even food. Sometimes it would be like crunchy and Coke.
Okay.
A lot of the time that would be lunch. So I didn't do all the things I needed to either. So I did start seeing, okay, wait, what am I doing? So then I started asking, what am I doing that's contributing to this? So I started like making notes of little things that I was doing, and a lot of it was with my food, to be honest.
Okay.
And the fact that I didn't sleep. I since I lost sleep with my back, I hadn't been sleeping.
Not sleeping well, or
I hadn't. Like, I would be up. You could call me at 3:30 in the morning, and I'll be up. I'll be like, "What's up?" I'm just wide awake with nothing to do.
So then when do you get your rest?
I don't know.
You weren't getting it.
Yeah, I think I got used to it. So I started working on my sleep.
Okay.
I did support my sleep in the beginning, and then over time, it's sort of just started coming to me, and that made a big difference. My sleep and my food.
Wow.
Yeah. And then that's when now I was like, wait, if I could do like this big thing just by changing what I'm eating, how I'm sleeping. I did obviously use a few supplements here and there, and my migraines went away. I was like, wait, like you could actually do a lot more if you were doing this consistently as a lifestyle. Now that's when I decided to go into functional medicine.
Wow.
Yeah.
let's just breathe, because so much, like all that pain and all that you went through, and you said your migraines went away.
Yeah.
Like what a relief, like
For-
of like years of pain, and then
Yeah, for over a year, I was good. Like I wasn't having, like, you know, the typical migraine. On and off, there were a couple of episodes, but not anything close to what I'd been experiencing. So I think overall, great win.
let's go back to your like you were saying, numbness in fingers and your the back pain. So that was sorted with the nerve pinching.
I did a couple of things. One was getting like these lumbar injections,
Okay.
to just help with the pain. In hindsight, I'm not sure that was the best choice, but it helped manage the pain. So at least that dulling of the pain helped me gain some mental clarity. And then after that, I actually just decided to, again, do a little bit of my own research. I went back to the gym, started weight training again. I still maintained my physio sessions when I needed them. And I got better. Like, it wasn't like a dramatic change all of a sudden. It just happened so gradually that one day I woke up and I realized, oh, wait, like, I haven't been experiencing pain in my back or my leg.
So you started working out,
Yeah.
lifting weights, or?
Yeah. So I used to weight train before, and then it just sort of got away from me. I dropped the ball there. Yeah. So going back to it, like, felt very natural, and it really did help. Just help with, like, you know, supporting your skeletal system. And I guess that's one of the things that really helped get rid of that pain.
Wow.
So I don't know what, like, it looks like now, what my spine looks like now, because I haven't done like any recent MRI, but I'm feeling okay.
Yeah.
My hands have had a challenge still over the years, but I think in the past year, I've gotten considerably better. Again, a lot of working on strength. So I still don't know exactly what's going on there, but I do believe that it's a lot to do with weakness in muscles and things like that. Yeah, so I'm working on that at the moment.
Wow,
Yeah.
awesome. I just want to ask you a simple question. You know, for those of us who are like hearing functional medicine for the first time, please explain to us, like in simple terms, what that is.
Okay, so functional medicine is basically where we integrate it's like a multi-system integration. So looking at your genetics, looking at your environment, your lifestyle, your stresses, and your biology, how they're interacting with each other over a period of time, or how they have interacted with each other over a period of time, to create disease or dysfunction.
Okay.
So let me try and give you an example.
So if I come to you and say I've got, let's say, a headache or some sort of issue, we would start looking at the head or not the head.
Okay, so so we wouldn't just focus on the head.
Okay.
Yeah. So actually, what I was gonna say was, we do this alongside conventional medicine.
Okay.
So you're not like taking away conventional medicine. It's important, and it's necessary. With functional medicine, we're just not isolating symptoms. We are trying to find out, why are those symptoms coming on. So it's not about which pill is going to fix what. It's more about, why is it happening, and then understand that and fix that. So in the case where you come in complaining of headaches, if it's a chronic issue, then yes, of course, we consider a lot of what you've already done on the conventional medicine side, because a lot of the time, by the time you're looking for other answers, you've already gone through the normal path, right? So we're looking at how is your gut functioning, how are your hormones functioning, how's your nervous system doing. We're looking at what your stresses have been. We're looking at obviously, depending on what's the presentation of the headaches, how long you've had them. It guides us to map out a pattern. Once we have a pattern, then now we have to figure out why the pattern.
Okay.
Yeah.
So you look at everything, the whole lifestyle and everything to get to the root cause of what's happening and why it's happening.
Exactly.
I love that, because every time we go to the doctor, then we're given, like, if it's a cough, then just to get rid of the cough, right? If it's stomach issue, then we're just dealing with, stomach, just it's symptoms based, basically, right? So this is looking at the root cause of everything.
Yeah. You're looking at root cause, especially in chronic conditions. We can have like acute episodes of something, maybe because of an infection, or something you ate that didn't sit well with you. Which, I mean, if you address through conventional medicine, you'll be fine.
Yeah.
But when that's happening repeatedly, for example, that infection, if you've had to be on repeated rounds of antibiotics, it might have some implications. Now, that's what we want to address. Yeah.
Okay, got it. So now you say some of these symptoms that you had and you brushed off, like, if symptoms are signals, right? How many of those signals do we ignore on, like, everyday, lives? Like, for example, I'll tell you, I get gas.
Yeah.
And I've told you this before, and I've been ignoring it for so many years. But do I have to? No, right?
No, I mean, of course not. Having like chronic gas, I don't know why I'm saying chronic so much, but having, like, if you're experiencing gas after multiple meals, or it's been happening over a long period of time, it's not normal.
Yeah.
There has to be a reason that's happening. Now, that is one of the things that we do brush off. We're like, oh no, but it happens. Oh, I ate mug, or I ate beans, and
Exactly.
It shouldn't happen. Like,
it shouldn't.
Yeah,
it's not
your
normal,
digestive
right?
system should be able to handle digesting beans, or whatever your food triggers are. So that's one of the things we want to find out.
So if anything that is not normal, and is happening more than once or more than few times, if it's happening repeatedly, it's not normal.
So what I would say is, obviously there isn't a defined norm for all of us together. What may be normal for you may not be normal for me.
No, but like, for example, sorry.
Yeah, sure.
An ache somewhere that we brush off, saying, oh, I worked out, and it's constantly there. Or stiffness that just doesn't go.
Yeah. So, that's not normal. So you were asking me what we might consider normal.
Okay.
Like when we wake up in the morning in our 30s and our 40s, we joke and we're like, oh, welcome to your 30s, because you wake up with a stiff back. It's not normal.
It's not, right?
But we're just like, but that happens.
Yeah.
So, it's fine. It's not a big deal. Right now, it's not. But eventually it's going to be. So is that what you're like talking about, right?
Yes, like feeling lethargic at any time. I mean, waking up lethargic.
Yeah.
That's not, it shouldn't be.
No, you shouldn't. If you've got in good sleep, enough sleep, then you shouldn't wake up tired, because you've gotten that chance to rest and recover. So when you wake up, you should be feeling pretty good.
Yeah.
Not tired. But also, it happens, right? Yeah. We wake up tired so often that it feels like, this is how people wake up.
Exactly.
It's not. Yeah.
Oh. Okay. Very, very good question. While working on all this holistically, did you ever work on your emotional side, the stressors, the stress?
Yeah, I did. So actually, I guess I was forced to work on it a lot earlier. So throughout this whole period, I was working on a lot of things. And as like we went in deeper and deeper, I found more and more things that I needed to heal from, maybe even accept and just let go of.
So you're working on your own or with somebody at this point?
No, I was in therapy.
Okay.
I was in therapy for a while because I wasn't, like I said, I wasn't doing very well. Like my mental health declined. So that was one of the periods where I did end up in therapy again. But even before then, I had I had this moment, you know, when you, like we were just talking about symptoms, feeling like they're just normal. They will come a point where if you won't address it, your body will force you to. That's sort of what happened to me. So I ended up in therapy, and that's when now I did start doing a lot of work, but I was aware long before then that I needed to get some help. First place it started from was just from a lot of assessments from my physiotherapist. He just made a remark and he's like, you know, there is a lot of, when you have a lot of like emotional
When you're holding
trauma,
on to,
or you've just held on to a lot of emotion, it manifests onto your left side of the body. At that time, I was like, yeah, not talking about it. But over time, I actually thought about what he said, and there was truth to it. So going to therapy helped me a lot.
I love how open you're about this, because up until some years ago, there was a lot of stigma about, you know, people going to therapy, and we was a bit hush-hush. But obviously now we're all talking about it, and not only talking about it, but how important it is, right?
Yeah.
And I worked on myself as well. I didn't go to a therapist, but I did a program called Healthy Relationships. And in that, we went through all these things that you're talking about, like acceptance and sometimes maybe just surrender, and even forgiveness, like not forgiving another person, but just forgiving myself, my younger self, because like I didn't know any better, or there's no point now saying I could have done that, or, you know, people did what they did, like, but I had to just accept and surrender and then move on. And my God, there was so much that I was holding on to.
Yeah.
And I feel like emotional healing, whether it's in therapy or group coaching or programs like this, should be done every year or repeatedly upon someone's needs, right? Because life is happening. It's continuously happening,
Yeah.
right?
Therapy doesn't necessarily mean something dramatically going on with your mental health. It just sometimes can be just a little outlet, even for you, or just to improve on yourself.
Exactly.
I think we could all be a little better.
Yes.
So yeah, I think it's more of self-improvement.
And also these things I feel like are not taught anywhere. The tools that we are taught in therapies or programs for emotional well-being, when we go there, it's basically the tools that we learn for everyday life, right? We're not taught these in school or anywhere else. So then it's so important to like learn them, even if we just take it as you say, learning.
Yeah, it's more of like self-improvement. Not obviously not at all times. There are times where you genuinely need the therapy just to bring you to a more stable place because your mental health is struggling. But even if it's not struggling, it's not a bad idea.
Yeah.
So functional medicine would also, like, that is part of it. So I'm not obviously a registered or licensed psychologist, but if we find through assessments that this is actually one of like the bigger triggers for a lot of what's going on with the patient, then we want to bring in other personnel on board. So like a psychologist that's appropriate for that patient. So you're working with a lot of different people. You're not claiming to be able to take care of every single need the patient has. It's more about identifying what they need and then getting them different sources of help.
Okay. Okay, so what was the most surprising thing that you learned about yourself, your body, your mind through all this?
I think the resilience. I don't know if it was built or it was just there, but I was surprised to actually see that. Also, I don't know if this should sound surprising, but that there was a lot of what I was experiencing was because of myself. Like, the way I've been eating, the way I've been living. Like at some point, just unwilling to confront, certain emotional situations, and the impact the stress from all of that was having on me. I was maybe a little delusional. I was like, but I know it's stressful, but I'm not really feeling stressed. I'm okay. But it really was having a significant impact on me, especially in this last year in 2025. So yeah, I don't think we should ignore certain stresses. They may be doing more to you than you realize.
But then the society has put so much, like right now, there's so much we need to be able to get done, like, in terms of work, in terms of, let's even take just the health side of things, like, right, as soon as you wake up, right, you must do yoga, you must meditate, you must eat right, you must, work out, you must walk 10,000 steps, and then now add work to it, like full on work. Normal 8 to 5 work wouldn't cut it. Now we need to, like, in a competitive environment, like if we're putting that extra hour, right, then only, like, you'll achieve something or outshine people, right, and get that promotion.
Yeah.
Then add kids to that equation, or husbands or kids, or like, my mind is just going woo.
Yeah. I mean, I can't speak for having husbands or kids, but I think my learning lesson from all of this is, and I think it came to like peak towards the end of last year, was like exactly what you said. We feel like we're in this rat race sort of thing, and you have to come out on top. But do you? Like, the truth is, do we really need to come out on top? Maybe we try and understand what's important to us, because then you'll be able to focus on those things, and it will be worth it. It won't matter what a lot of the outside chatter and noise is, as long as you're content and happy with what you are doing with your life and what your life looks like. And that can only come from you. I don't know if that makes sense.
It does make sense, yes.
We may believe that we need to be doing a certain way at work, or we need to be living a certain way, whether it's how we travel or the houses we live in or the cars we drive. Those things can be important, and they can sort of take over and then sort of help you make your choices in life. And then you're content and happy with that. Or you find out and you listen to the voice in your head, regarding what's important to you. Why do you want X or Y thing? How's it going to make you feel? If you can identify all of those things, if you can identify what's important to you, it's not going to matter what the outside chatter is, what society chatter is, because you don't really have to compete with anyone.
Yes,
And it's a
so
process.
true.
It's
Yes,
a
it's a
process.
process, and now, I mean, than ever, we all need to reflect and pause. You know, because just opening our phone can be so overwhelming because everyone's living their best life, right? Like that's all we see on social media. Obviously, now we know that's not true, right?
Yeah.
So that message is so powerful of pausing and reflecting and really asking ourselves, you know.
Yeah, because I feel like a lot of the time, our choices are guided by not what we actually want, but what we think we need to have or we need to want because of our surroundings. So if that isn't lining up, then maybe we try and focus on changing those things as opposed to compromising on what's important to you. And it could be different things for different people.
Yeah, and in your case it was health.
For me, it's
ultimate
health.
like
Yeah. For me, it was my health. It was also just being content and happy with the kind of work that I was doing, which is why I left my job. And it was scary because most people would be like, you just left a job, like you don't have an income now, you don't have a job now, what are you going to do? And for a moment I was like, wait, what? Like we're actually well, they're not wrong in what they're saying if we're thinking about what's important to everybody else. But for me, I think focusing on my health is more important, and also focusing on trying to do something with my life that is going to be meaningful to me, impactful to me, instead of just walking this path that we think we have to walk.
so powerful.
Yeah.
And so now, do you not work, or you?
I'm back to work, but I did take a long break. I had to sort out a few health issues. So I am doing well now, and I feel like, okay, now I can focus on, I don't need to focus on everything at the same time. I've managed to take care of my health. So now I'm able to focus.
Okay, so if anybody would want to get in touch with you, is that okay for them to reach out to you?
Yeah, sure. I'm happy to help in the ways that I can. They can reach out to me if you want. You can share my contact details with them or my email.
Oh, thank you so much, because I know a lot of people would have a lot of questions, and so many of us are like suffering in silence, like and yeah, we shouldn't have to.
Yeah, no, they're more than welcome. I'm happy to answer any questions or concerns anybody has.
Thank you so much. Thank you, Krupa.
Thank you for having me here.